So today, right, today's topic is diving into blood sugar, right? So a lot of people are familiar with diabetes and various types of things, and we're going to talk about those things. But right, blood sugar in essence is key to life, right? It's how we fuel our bodies. So today, what my goals are to kind of go through simply of well, how do we even regulate blood sugar? Because I think the better we can understand how we regulate blood sugar, then we can understand when certain conditions occur, kind of where they go wrong. So then we can start thinking about what's the appropriate testing and the most accurate testing to figure out the different types of diabetes. And once we figure that out, what are the most appropriate treatment plans, right? I'm going to talk about a few kind of takeaways of things that you can utilize. One big thing we're going to talk in depth on is going to be fasting. But the thing is, there can be so many different types. So you want to be careful about just doing one thing because it may not be appropriate for you. So I'm going to emphasize over and over again how key it is to have a healthcare provider and to kind of get the appropriate testing. I'm going to let you know the appropriate testing you need. Okay, so let's get rocking and rolling. Okay, so for the first section, let's talk a little bit about the physiology of regulating glucose, right? So how does our body even regulate glucose? Okay, so we eat a meal, could be a donut, could be a steak, whatever it may be, right? It gets broken down into proteins, more specifically amino acids, carbs, sugars, fats, all those different things, okay? As those things enter the bloodstream, they have to go places. They need to either go to the liver to stock up energy, go to muscles to fuel your next workout, go to your brain, go to all your organs so you have more energy. So then the question is, when you eat something and your blood sugar goes up, what allows you to uptake that new fuel into cells, right? That's the role of insulin. So some of you may be familiar with insulin, might have heard it. A lot of you might know a lot about it. Some of you may know nothing about it, right? In simple terms, insulin is the gatekeeper to allow sugar into cells in all sorts of different types of cells. So we talk later about when insulin gets kind of messed up, how can it cause certain types of conditions, okay? Once insulin's released, it allows blood sugar to leave the bloodstream and to enter cells, and then hopefully allow glucose or blood sugar to drop back down to a normal amount, right? Sometimes it can drop too low. This is where people can get what's called reactive hypoglycemia, right? And they get kind of shaky, they feel fatigued, or sometimes it doesn't come down as low as we would like. Okay, we're not going to necessarily talk as much about the action of glucagon, although important in this process. That plays more of a role of when you have low levels of blood sugar, that's something that you release to help you break down blood sugar from your liver and muscles to then give you that blood sugar you need. So I kind of want to focus a little bit more on the insulin piece, right? So you eat a meal, blood sugar goes up, insulin is released. Insulin allows you to utilize that blood sugar and drop your blood glucose down to a healthy level that's safe. Okay, simple terms, that's how we regulate blood glucose. Okay, so let's talk a little bit about different types of diabetes. Okay, so we talked about the physiology of blood sugar. So what happens when that system goes wrong? There's many forms of diabetes. Some will state upwards of 5 to 6. We're going to really only talk about three main ones, right? We don't want to get too in depth into different ones. These are some of the three big ones that we see, and they're important because one of them I see gets overlooked quite often and can look just like type 1 and type 2. So let's talk first about type 1, right? Okay, so when we look at type 1, okay, a lot of you may be familiar with this, right? A lot of times this develops early on in childhood, okay? Maybe early on in birth, usually younger it occurs, right? And type 1 diabetes is pretty much an autoimmune disease. So your immune system attacks cells in your pancreas. Your pancreas is the area that creates insulin, right? And it decreases your ability to produce insulin. Okay, that's why a lot of type 1 diabetics have to wear insulin pumps. They need to get insulin because they can't produce insulin because their immune system is attacking it, right? So if they can't produce insulin, their blood sugar is going to be really, really high. So that's type 1 diabetes kind of in a nutshell. Okay, type 2, which we see very commonly, we see is rising each day statistically in the United States, which is alarming, right? This one usually doesn't have any autoimmune characteristics towards it, right? It's not an autoimmune disorder. There doesn't tend to really be any genetic linkage, right? This is a lot of times lifestyle induced, right? Poor diet, no exercise, smoking, drink, all sorts of things. We could spend a whole lecture going into those things. But the problem with this, and we'll get more into this into depth, is that the receptors that receive insulin no longer are very sensitive to it. So it allows for more blood sugar to stay in the bloodstream. Okay. And then we have type 1.5. In this form is more autoimmune, right? And we'll get more in depth in each of these as we move forward. So let's move on to the next slide. Okay. So to understand type 1 and type 2, and even type 1.5, we need to kind of understand how insulin works. Okay. So on all sorts of different cells, muscle cells, brain cells, all sorts of different tissue, right? You have insulin receptors. Okay. And then you have what are called glucose channels, okay, or glucose transport systems. Okay. Think of those as kind of like a lock and a key. As long as insulin's not attached, they stay closed. When insulin attaches, it's like the key that opens up the channel and allows glucose to be uptake, right? So when insulin attaches to its appropriate receptor and that receptor is sensitive to it, it allows glucose in, right? In simple terms, that's how insulin works. So if we look at type 1 versus type 2 diabetes, right? One is you produce insulin because your immune system is attacking what are called your islet cells, right, in your pancreas, and those are what produce insulin. So now you have all this glucose coming in, no insulin. This can lead to very, very dangerously high levels of glucose. It can lead to death and coma, right? And this is why these type of cases, these individuals need to be on insulin to help manage their case, okay? But then we have type 2 diabetes. Okay. And type 2 diabetes eventually can look like type 1 in that you kind of stop producing insulin. But what happens is frequent levels of excessively high glucose cause insulin receptors to become less sensitive, right? So think of it this way. If you're a receptor and whatever you're detecting there's less of, you need to be more sensitive and more attuned to picking up that molecule so that you can work appropriately. If you're getting pelted by blood sugar all day long, you're going to say, hey, you know what, guys? We need less workers. We don't need as many receptors. We got plenty of glucose. Let's downregulate and let's become less sensitive. The problem is that eventually this insulin insensitivity leads to higher and higher levels of blood glucose. So you can see where type 1 and type 2 can both lead to elevated blood glucose, but from different mechanisms. One is you don't produce it, the other is your receptors are no longer sensitive. Therefore, simply, if you can do something to improve sensitivity of insulin receptors, you can make huge improvements in type 2 diabetes, right? And we'll talk about some of those things and some of those pathways that play a role in that. Okay. And then let's look at type 1.5, and this may be totally new to a lot of you. Some of you may be familiar. Type 1.5, or what's also called latent autoimmune diabetes, right? This kind of looks a lot like type 1. Sometimes it looks like type 2, right? But it doesn't really respond to the treatments for either or, right? So this usually occurs later on in life. Usually after 30 is classified as latent autoimmune diabetes. This can also be that individual you see where you say, hey, that guy's really skinny. He looks pretty fit, but he's got diabetes. That doesn't make much sense. That's where you start looking at an autoimmune correlation, right? And why this is so important is it's so important to identify this because a lot of individuals will try to treat this like either type 1 or treat this like type 2, and they really don't get much progress because really you need to treat it like an autoimmune disease. For whatever reason, whether it be an infection, whether it be chemical exposures or different things like that, something is tricking your immune system into thinking that your pancreas is an invader and starting to destroy your cells that produce insulin, but later in life, right? So the better you can handle the autoimmune disease, a lot of times you can get on top of that. And actually, we have a really cool patient success we had uh, probably like a year ago, who had really poorly managed diabetes. They had said she had type 2 diabetes. Her blood sugar was in the 300s. Her A1C was 11. For those of you who don't know that, that's crazy, crazy high and dangerous levels. And everyone kept kind of writing her off saying, well, you're not eating well. You're not doing the things we tell you. And she was doing everything everyone told her, right? And then we tested her and found that she had type 1.5. And it wasn't until we treated her appropriately with autoimmune protocols that she was able to get everything under control and get her diabetes managed, right? But the key was getting the right testing for that patient because it totally changes what you do and your outcomes. And that's why it's really, really important to find a doctor who is trained in these things to help guide you or guide your loved one. Okay, so let's talk about testing. So we talked about some of the three main types of diabetes. Well, how do we determine which one we may have? Okay, this is where testing comes into play. This list has a lot of things, but isn't everything, right? There can be some other testing that's important, but I want to talk on some of the main points, right? One being fasting glucose, hemoglobin A1C, fasting insulin, Cpeptide, autoantibodies, CRP, hormones, and different tests to look at endocrine function. So let's look at each of these individually. So fasting insulin, okay? So this is actually, nope. I apologize, guys. Don't mind me. This slide is labeled inappropriately. That is my fault. This should be fasting glucose, not fasting insulin. I repeat, this should be fasting glucose, not insulin. That is a typo on my part. I apologize. So when we look at fasting glucose, right, that's just a snapshot into blood sugar. What we're doing is having someone go on a 10 to 12-hour fast. We're taking their blood and we're saying at that moment in time, what is their blood sugar level? So once again, it's a good test, but it's a very small window into an individual, right? When we look at values, and these are kind of more standard values in medicine, I have different kind of values that I look at as being optimal. But when you look at values, anything 100 and below is normal. Optimally, and when you look at a lot of longevity research, we like to see it below 85 and sometimes even lower than that. Pre-diabetic is 100 to 125, and 125 and above is characterized as diabetic. Once again, this is a snapshot. Individuals can have high blood glucose in the morning due to cortisol responses. So it's actually normal to have elevated levels of blood sugar within the first hour of waking because it's actually your body secreting cortisol to bump up your blood sugar to give you energy. All right. So sometimes the timing you do the test can kind of give you a poor picture. If you ate a meal close by, there can be a lot of different things. If you're really stressed, even caffeine use. So we take this as a snapshot and we say, okay, so their fasting glucose is a little bit elevated. Let's kind of look at a marker that's going to give us a better, more accurate window over a longer period of time. This is where hemoglobin A1C comes into play. Much more accurate and reliable indicator of blood sugar over an extended period of time. So what hemoglobin A1C is looking at how much blood sugar attaches to a red blood cell during its lifespan, which is 2 to 3 months. So it's looking on average your glucose levels over 2 to 3 month period. You can see where this is a much more accurate measurement of blood glucose because you could have a great A1C and your fasting glucose is high and saying, okay, well, let's check that, but it's probably nothing really big, right? Versus A1C gives you a much, much better picture, okay? But anything below 5.6 is normal. 5.7 to 6.4 is characterized as pre-diabetic, and 6.5 and above would be categorized as diabetic, right? So say we have, fasting glucose is high, A1C is high, we start to say, okay, there's too much blood sugar in the vessels. Why is that? Is it an autoimmune issue where you're not producing insulin, or are the receptors just not as sensitive as they need to be? This is where we're going to look at some more testing to give us a better picture. Okay, so two things And these might be a little bit newer to most of you, but one is called Cpeptide and the other is called fasting insulin. Okay. These two are really good in saying, are you producing a lot of insulin or are you not producing insulin? So if you have high blood sugar, you got to figure out, is it because the receptors are not sensitive or are you just not producing it? And that's where these two markers can play a big, big role. Okay. So, like we talked about, insulin helps glucose come into cells, right? So, if one is insulin resistant or their cells aren't very sensitive to insulin, you're going to have higher levels of insulin trying to get you to uptake that glucose, right? So, you may have an individual with high A1C, high fasting glucose, and their insulin is really, really high. So you say, okay, they don't have trouble producing insulin. Their receptors just aren't listening to insulin. Okay. But you also have what's called C-peptide. And if you look at a lot of research, a lot of people will say that C-peptide is a better representation of pancreas function because C-peptide is a molecule that's made at the same rate as insulin. So it's pretty much a good marker of if you have this much insulin, you're going to have this much C-peptide. But the thing is, C-peptide, it doesn't degrade as fast. So it stays in the system longer versus insulin's degraded pretty fast. So you may not get an accurate measurement. So those are the pros and cons of C-peptide versus fasting insulin, both great markers. One is a little bit more reliable, the C-peptide versus the fasting insulin, but they both can give you a picture of more so type 1, type 1.5, type 2, okay? This leads me to antibody testing. So maybe we have an individual and things just aren't making sense. Say they have, elevated blood glucose, their insulin levels maybe are normal or they're on the lower end. They're an adult and this kind of came on later, right? We start looking at antibody testing, right? And there's a few different antibodies we can look at. One is called GAD65 or glutamate decarboxylase. Once again, these are big words you don't need to remember, but just so you know. And then insulin and islet cell antigens or antibodies. Okay, so these are looking at saying, are you making antibodies against different parts of your body that help you produce insulin? And there's a really good panel from Cyrex. Cyrex is Array 6 that actually is able to test for all of this, right? So if you're at your doctor, and we use this with patients all the time, and you're thinking, hey, I think this might be more 1.5 or latent adult autoimmune, well, let's run a Cyrex panel and see. And so now you have all these different things to say, is this more type 1? Is this type 1.5? Is this type 2? Because if you can better identify that, then you can have better outcomes because you can have specific treatment protocols for yourself. Okay, so this is kind of like a little chart to kind of review what we talked about, right? So if you have an individual that's maybe overweight and you start to say, okay, they're fasting insulin or their C-peptide, okay, that seems to be elevated, right? Or we're looking at those things, right? So we're saying this individual is overweight, yes, okay. Their fasting insulin and C-peptide levels are high, most likely type 2 diabetes, right? Because they're not able to utilize insulin. Versus maybe you have an individual that's overweight and their fasting insulin is actually low, so they're not really producing insulin. You then need to test for the autoantibodies, right? And if they have them, then you know it's more of a type 1.5 versus if they're not there, that's where you can get into kind of other forms of diabetes. We're not going to talk about this evening, but some other forms like MODY diabetes, okay? And if we say, okay, no, the individual's, pretty skinny, pretty fit, everything looks great, okay, have some blood sugar issues, let's go directly into looking at autoantibodies. And once again, if those are present, we're looking at more of a type 1.5. And if those aren't present, right, then we need to look at insulin. And if it's high, then it could still be type 2. And if not, once again, we go to more of that idiopathic type. So once again, not using this to train you guys to be doctors, but giving you a reference. So when you have your labs, you kind of have a thought process saying, whoa, 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 I'm seeing this, and being able to challenge your doctor and ask your doctor appropriate questions. Say, well, what about this test because of this, right? My goal is always to empower patients to be able to take their health into their own hands. Once again, I know not everyone is a doctor or wants to be one, but I think everyone should have the right to know their body and to know kind of how it works and be able to challenge doctors. Okay. So briefly, what I want to do is I want to talk about sugar's effect on the brain, right? Sugar affects cardiovascular system, peripheral nerves. It affects about everything, right? But I'm a brain guy. I like the brain. I work with brains and brain injuries a lot. So I'm going to talk more specifically on how sugar affects the brain, right? We've spent all of this time discussing different types of disorders with blood sugar, but why do we really care? Why is it really a bad thing if blood sugar is high or if it's low or if insulin levels are high or low? Why should we really care? Well, let's look at what those things do to our brain, right? So when we look at sugar and high levels of sugar, they love to bind to proteins, fats, and DNA, right? And this is a process called glycation, right? And what that does is when they bind, they create malfunctioning cells, right? So we know that a big thing that leads to aging is mutations or malfunctioning of cells. So when you change the structure of a cell, you change what it does. You change how everyone else in the body perceives it, right? And then that changes the end result. So sugar can cause malfunction and mutation of most cells in the body when at high levels, okay? Sugar increases oxidative stress and inflammation, right? Two things that can also lead to increase in aging and increase in mortality. Okay. And the other big thing is that it affects myelin, right? Myelin is the connective sheath around your neurons that increases the speed to communication, right? An example of a disorder where goes awry is MS or multiple sclerosis, right? And these individuals create all sorts of neurological symptoms and signs because their brain no longer can communicate because the highways aren't properly insulated, right? So these are some big ways that blood sugar can affect your brain. So going back to it, like we talked about, one of the big things is glycation, right? This occurs from poor blood sugar control, right? By eating too much or once again having autoimmune condition, whatever it may be, right? That excess sugar, right, binds to these proteins and causes the malformation. So I want you to remember that term glycation. It's super, super important because we know that all forms of diabetes are going to lead to elevated blood sugar at one point or the other. And that is dangerous because it damages all types of cells, right? Specifically brain cells. Okay. Some of you may recognize this from my last presentation when I discussed dementias, right? Blood sugar is heavily, heavily related to cognitive decline in dementias. Okay. When you look at high blood sugar, most of the time that means high insulin. Now, remember, if we talked about in certain autoimmune cases, that's not the case, but in type 2 diabetes, it's going to lead to high insulin. Well, why do we care about high insulin? Why is it bad for us? Okay. Right. So when we look at high levels of insulin, right, you have a certain enzyme in your body, and specifically in your brain, right? It's called your insulin degrading enzyme. Right? So when you produce excessive amounts of insulin, this enzyme is meant to break down that insulin and remove it, right? Because you don't want it sitting there all day long. Okay. The problem is beta amyloid plaque, which is the hallmark protein associated with Alzheimer's disease, is also broken down by the insulin degrading enzyme. Well, this comes to become a problem. The enzyme can only do so much work, right? If you have high levels of beta amyloid plaque and high levels of insulin, it usually prefers to degrade the insulin before breaking down the beta amyloid plaque. This causes a problem because now you can see high insulin levels are going to lead to a decrease in your ability to clear some of these negative damaging proteins out of your brain, right? The more these proteins accumulate, the more they can lead to things like Parkinson's, Alzheimer's, Lewy body dementia, all sorts of things that none of us want or none of us want our loved ones to experience, right? So we can see getting insulin to a appropriate level, and usually lower the better, is going to be really, really helpful in brain health. Okay. And when they're elevated, it's going to lead to inflammation and breakdown within the brain. Okay. And this is where we talk about what's called type 3 diabetes, actually. So we talked about type 1, type 2, type 1.5, and what they're starting to call now type 3 diabetes, which is related more so to Alzheimer's, right? Or different forms of dementia. So they're looking at this high insulin level these high blood sugar levels and all this inflammation. They're saying, wow, this is really causing a lot of damage to the brain and it's increasing individuals' risk for developing things like Alzheimer's, right? So once again, blood sugar management is important. Some of us may realize that, others may not realize it. And the thing is, a lot of times it doesn't have to be very complicated. Once again, type 1, different story a lot of times, but type 1.5 a little more difficult. But type 2, a lot of times is not difficult to manage. You just need the appropriate plan and support staff to help you through. Okay. So, with all that in mind, what I want to talk about is, right, we talked about all these things with blood sugar, right, and how they negatively affect things. There's one other pathway I want to touch on that's gaining a lot of tension in the anti-aging world, right? So individuals who want to say, I want to live longer, or how do we slow down death and aging? And once again, blood sugar is a big key to that. And really, this is another system that elevated blood sugar will affect this pathway. Decreased blood sugar will affect this pathway, and they'll lead to either beneficial things or negative things. Okay. So the pathway is called your cyclic AMPK pathway. Don't worry about that big term. Pretty much it's your fuel gauge. So this is a pathway within cells that says, hey, we got plenty of energy, or hey, we don't have enough energy, right? So it's just a fuel gauge measuring whether it's a good time and where it's time to flourish, or whether it's a bad time and we need more fuel, right? So whenever there's decreased fuel available, so decreased blood sugar, maybe an individual hasn't eaten over the past 12 hours or they've been exercising, you get an increase in that AMPK activity, right? So you get an increase in that pathway, and this pathway makes you more efficient in uptaking glucose. So it actually makes you more sensitive to insulin. Remember, if someone's got type 2, they're no longer sensitive to insulin. So one way that we can improve that is we can find ways to stimulate this pathway to improve your sensitivity, because your body's saying, hey, we need fuel now. It also increases fatty acid oxidation, so it helps you burn fat. I think all of us would love that. And then it improves something called autophagy, or your cleanup system. This helps to take dead, old used cells and kind of get rid of them. Okay. When we have decreased activity of AMPK, so times where we're plenty fed, so after like a Thanksgiving Day meal, or if our blood sugar is chronically elevated at 125, 150, 200, right? Your body's getting a message saying, hey, we got plenty of fuel. Let's decrease the activity of this pathway. So then that actually decreases your insulin sensitivity, decreases your ability to break down fats and to produce steroids. So all the things none of us want. So this is where this can lead to weight gain, fatigue, diabetes, things like that. Right? So this pathway is really, really cool and really important to understand, because there's things we can do to affect this pathway and increase its activity to benefit patients or individuals with diabetes. Not only diabetes, but also to live longer. Okay. So let's talk a little bit about some of those. Okay. So like I mentioned, right, as we age, this system breaks down. Right. So that's why as individuals age, they tend to gain weight. There's an increase in inflammation, right? It leads to increased blood sugar levels. So you have a form of diabetes that is actually kind of occurs more in older individuals. So it's not type 1 or type 2. They attribute it more to aging, and that's most likely breakdown in this pathway we were talking about. But let's talk about some things that stimulate it. One of the most used and well-known and researched things that stimulates this pathway is metformin. So some of you listening to this may have diabetes or may know someone who has diabetes, and that's on metformin. More often than not, they are, right? And metformin actually is a pretty phenomenal drug a lot of times in managing type 2 diabetics. And it's actually being used a lot in the anti-aging world, but it also comes with some downsides, right? So this is the pathway that metformin works on to improve diabetics, okay? But we also have what are called calorie restriction mimetics. So these are more natural compounds that mimic calorie restriction and force an increase in activity of the cyclic AMPK pathway. That's pretty cool, right? So in a second, we're going to talk a lot about fasting, but there's some stuff that can mimic fasting, but without actually having to fast. I like that, right? And the main things are resveratrol, torostabine, which is a kind of an analog to resveratrol, and another thing called ECGC, right? This is found in green tea, quercetin, and then curcumin or turmeric, right? So a lot of you may be familiar with these things, and these are really cool. And there's one other that I left off that actually is really good is berberine. So berberine is actually another great one that acts as a calorie mimetic. And actually there's some research showing it to be almost just as effective as metformin, which is pretty cool, right? So that's a supplement we use with a lot of patients. So these are some supplements that can increase that activity so they'll improve insulin sensitivity. They help to decrease blood sugar. They'll help with decreasing inflammation. All these really, really beneficial things, okay? Which leads me to kind of the final things we're going to talk about, and that's going to be fasting. Once again, there's so many things we can discuss in regards to blood sugar, exercise, the types of food, all these different things, right? But what I want to touch on is fasting because it's really, really big now. A lot of people have a ton of questions on it. They don't know how to do it, or they do it and they feel worse, right? So I'm going to kind of talk through fasting and how to utilize fasting to improve blood sugar. Once again, as I go through this, it's really important to discuss with your doctor before partaking in any of these activities. Okay? So what is fasting? In simple, fasting is just abstaining from food for an extended period of time. That time could be 12 hours to 4 weeks, right? And that will determine the type of fast that's occurring, okay? And this is where fasting and calorie restriction are two different things, okay? So what are some different types of fasting? We hear so much about intermittent fasting all the time, but it's not the only type of fasting. When we look at intermittent fasting, it's looking at restricting food or caloric intake for anywhere between 12 to 24 hours. Okay. And that has specific effects on your body and activates that cyclic AMPK pathway. And then we have what's called prolonged fasting, which is fasting anywhere from 2 to 5 days up to 4 weeks. Right? This is something that I highly advise that you are working with a trained practitioner on because there's some things that can go wrong with this. Okay. And then there's water fasting, bone broth fast, what's called a dry fast, right? Time restricted feeding windows, which is pretty much like intermittent fasting, and then what's called the fasting mimicking diet. Okay, this is more looking at calorie restriction. So there's a researcher of the name of Walter Longo who discovered that he can just limit calories. I think it's around 70% of what you normally eat. So eating about 30% of what you normally eat, and you're able to get the same exact effects as just doing a 5-day water fast, right? But without actually having to fast, which I think is really, really cool. So these are the different types of fasting. Okay. So let's talk about the physiology of fasting. What actually happens when we stop eating food? This goes back to kind of that pathway I talked about. Usually within the first 12 to 24 hours, right, there's a large reduction in blood sugar. Okay. This forces your body to start utilizing stored blood sugar in your liver and things like that. Okay. Once you're starting to run low on that, you switch and you start breaking down your own fat, right, into what are called ketone bodies that some of you may be familiar in as a new form of energy source, right? The main ketone body that we're really interested in is something called beta hydroxybutyrate, okay? And this is where this molecule helps a ton with brain function, brain fog, energy, all weight loss, all these really, really beneficial things, okay? The ketones, right, they're produced from the liver, from fat tissues or broken down from proteins, right? And they kind of cycle through, and those become your new form of energy. Once again, when you look at some of the research, right, individuals can survive upwards of 30 plus days without food. So we have a really cool system where we can start burning fat for fuel, right? And this is what you see in a lot of diabetic patients is they're so used to using glucose as their only form of fuel, their body has no clue how to use fat, how to use proteins, right? So part of that is training them how to be metabolically flexible, how to use fats, how to use carbs, how to switch back and forth between the two and make them more metabolically flexible, right? So fasting is really, really cool and helpful in doing that. So when we look at a prolonged fast, let's kind of talk about what's actually occurring on all the days. When you look at day 1 to day 2, your body, once again, is starting to burn through all the stored blood sugar you have, okay? Mostly stored in your liver. By about day 3, you're going to be running pretty low on that. And this is when your body will start producing ketones to help give a different form of energy. Okay. This is the time when a lot of people start to feel pretty crummy. But when they start to get to day 4, this is where some of the magic starts to begin. They start to clean house. They start to break down receptors, insulin receptors that aren't really efficient, and replace them with new and improved, really sensitive insulin receptors or new and improved brain cells and things like that. Okay. And around day 5, this is where we see a huge increase in stem cell production. So once again, stem cells are naive. They are cells that don't really have an identity. They don't have a purpose. And so when you produce new stem cells, depending where you need them, they can now take on the role of maybe a brain cell, a heart cell, a liver cell, something like that, right? So you're able to produce your own stem cells. So you don't need to go out and pay $5,000, $10,000 for stem cells, although that can be beneficial for some. I say start with fasting. Start with ways that produce your own stem cell production. And it's free, right? You're not even spending money on food. Okay. So, like we talked about, right, there's a lot of benefits when it comes to fasting. So, improving metabolic flexibility, so improving insulin sensitivity, decreasing blood sugar, helping to produce stem cells, helping to decrease inflammation, improve different things like BDNF or brain derived neurotrophic factor, which is like miracle grow for the brain. So, it helps you to build new pathways in your brain and make your brain stronger. It helps to improve immune function as well. So, fasting can have a ton of different benefits, which is really, really cool. Okay. Oh, let me go back. Okay. But an important caveat, once again, this goes back to some of the blood work I initially had talked about. Fasting, although very powerful, you need to make sure you're doing it with a educated practitioner, right? Because you need to make sure that your thyroid levels are healthy, sex hormone levels are healthy, that you're tracking things like fasting, insulin, and lipids, because these things can become altered in a good way. But if done too much or done inappropriately, it can affect them in a negative way. So it's really, really important that you don't rush out and just do this on your own. You find a educated practitioner that can help you with this, right? And we work with patients all the time in regards to this. Myself and Jess, who's our nutritionist, walk patients through and really guide them through how to utilize fasting to manage their diabetes and to manage their blood sugar. Okay. But that being said, there are individuals that should be wary of fasting. Once again, this is a lot of times patients before or after surgeries because they're a little more immune compromised, patients that are malnourished, patients with low blood pressure, patients that are pregnant, have heart conditions, have hypothyroid. There's a caveat to that. Hypothyroid patients can benefit from fasting, but you need to be careful about how you utilize it. You definitely, if you have hypothyroid and you're considering fasting, you definitely need to speak with a practitioner. We'd love to help you, so you can kind of talk with us and we can help guide you through that. And then individuals also with irregular menstrual cycles. Once again, fasting can help with those, but can also hurt them as well. So you need to make sure you're working with someone who knows their way around that to make sure when fasting appropriate and when it is not. All right. So to kind of summarize that up, we talked a lot about fasting, but if I want you to take away two big things, keep it simple. It's all about catabolism or breakdown, or anabolism, build up. People may be familiar with anabolism in regards to steroid use, right? Anabolic steroids, they build muscle, they build tissues. Catabolism, we break down. Remember that pathway we talked about? When we measure too low of energy, we increase activity of that pathway, which causes catabolism, breakdown of all these things to create new and improved things. And when that pathway is low because we have too much energy, this is where we cause anabolism and more so growth. Both are beneficial and you need both of them. Most look at anabolism and think, well, that sounds great. Catabolism sounds no fun. But you need a balance, because when you have too much anabolism, this can lead to autoimmune diseases and more specifically cancer. Right? Cancer is very, very associated with anything that increases growth. Right? If you're doing something to increase the growth of your muscles, you're not just growing muscle cells, you're also going to be growing other cells, right? And when cells are rapidly turning over, it can lead to cancer and things like that. That's why fasting can be really, really helpful in unison with other treatments in helping as an adjunct therapy to cancer. Okay, so just think about catabolism. Fasting helps you or forces you to break down things, and anabolism helps you to build things. And this leads me to my last point of what are called feast famine cycles. So when I see a lot of individuals do fasting, they kind of wreck themselves because they're just fasting all the time and they never refeed, right? So once again, fasting is beneficial because it mimics starvation. That starvation stimulates that signaling pathway to say, this is not a good time. We need more energy, forcing your body to become more efficient, forcing you to lower your blood sugar, improve insulin sensitivity. It forces everything to work better, right? But you don't want that long term. You need times where then you have building, right? And this is where we talk about feast famine cycles, right? So periods of fasting followed by periods of eating lots, right? And kind of going back and forth, right? So I really want you to take home the idea of feast famine cycles, right? And this is, some different ways you can kind of go about it, right? Is eating all your calories within an 8 to 12 hour window, right? Or intermittent fasting. So you have a 16-hour window of famine, and then you have an 8 to 12-hour window of feast. This is one way you can mimic that, right? That's intermittent fasting. Another way is working in a 24-hour feast once a week or a 24-hour fast once a week. And this is what I do. A lot of times I'll use intermittent fasting and then once a week I'll do a 24-hour fast, right? And I'll follow that 24-hour fast up with a huge, delicious meal. Not a meal full of donuts and pizza, but a really healthy meal to then say, I have that signaling of not enough. Now I'm going to have that feast, right? And going back and forth. And this is having that feast famine cycle is really what helps to keep your thyroid levels and your things like estrogen and testosterone in ideal levels. Because when you have too much famine, this is when individuals start to get low thyroid, low estrogen, low sex hormones, and things like that, right? And then once a quarter, I like to perform a 3 to 5 day water fast, right? So, kind of ways that you can incorporate all these different types of fasting, right? You can incorporate fasting every single day, and then you incorporate a different form in the form of a 24-hour fast once a week. And then once a quarter, you can work in a prolonged fast. Once again, we utilize all of these things with a lot of our patients with diabetes because it helps to reset the dial. It helps to reset your metabolic flexibility and help to improve your ability to use blood sugar and things like that, right? So I think that, let me change to the next. Okay. So what's your plan? What are you going to do? Right. So I gave you all this inflammation, all this information, right? All the things about why blood sugar is not great for me, how to fix it, all these different things, right? But what should you do moving forward, right? Step one, I would say, is to find a practitioner that can help you with all these things, right? And what I want to kind of offer everyone today who's here is the opportunity to kind of do a free 30-minute consult, right? So I want to open up to everyone that joined this webinar the opportunity to kind of sit down and we can kind of go over things, right? We can talk a little bit more about testing, what's the appropriate testing, things like that, right? So the key is to find a practitioner, right? And I would love to help each one of you or any loved ones you have, right? But the key is to get testing, right? So looking at fasting glucose, fasting insulin, Cpeptide, looking at antibodies, right? Lipid panel, all these different things. So you will have this. You say, hey, doctor, these are the things I really want to look at, right? So you have the tools moving forward with whoever your healthcare provider says, hey, let's look at these things so we can get a better idea of what's really going on. Okay. So what I want to put in here for you before we answer more questions. So in the attendee chat is going to be a link to a calendar. This calendar will have open slots where you can set up a time and we can either meet via phone call or meet in person free of charge. Like I said, just want to donate 30 minutes of my time to where I can kind of help guide you. Whether it's with the practitioner you're already working with or if you're looking for a new practitioner. We can go over labs, all sorts of different things. So I encourage you to reach out. Once again, it costs you nothing but your time. And it's a time where we can discuss a little bit more what's going on. And I encourage you guys to do it tonight, because once again, we only really have limited spots available over the next 2 weeks that are only going to be available for this talk. So once again, I encourage you guys to click on the link that I put in the attendee chat on Calendly. Love to talk with you and see if I can help you or help guide you in the right direction. So with that being said, let's look and see if there is some questions. Okay, so Sarah looks like she's got a question discussing the use of frozen fruit in orange juice and things like that. So great question. So a lot of individuals look at fruits and they think, oh, they're fruits. They're healthy. They're good for me. And although that's true in some sense, fruits are still sugar, right? Sugar is sugar. Sugar from a cookie is somewhat similar to sugar from fruit. They're different. One is more fructose and have different effects, but really they still affect blood sugar. Okay, and certain fruits can be higher in fiber, which helps to mitigate some of those responses to blood sugar. But other ones can spike your blood sugar just as much as a cookie. So as much as individuals think, "Hey, I'm getting my vitamin C from my orange juice," if you look at that label, a lot of times most orange juices have like 40 grams of sugar in a cup, right? And this is going to spike that blood sugar really high, right? And for that brief moment of time, it's going to affect insulin. It's going to cause inflammation. It's going to affect brain function. This is where individuals can get fatigued and brain fog and things like that. So be wary when drinking fruit juices because a lot of times they're just pure sugar, right? Versus it's better if you're going to eat fruit to eat the actual fruit that comes with the fibers, but to make sure to eat fruit in moderation for sure. Okay, so great question. Anyone else have any sort of questions for me? We got technically 12 more minutes to answer questions. So if people have questions, feel free to fire away in the chat section. Okay. Well, if no one's got any questions for me, then I would definitely like to thank all of you for coming out tonight. I know we talked about a lot. There's a lot of information. Oh, here we go. So we have a question from another individual. What happened? So let me get this question right, is if you have a family history of diabetes. So great question. It depends on what type of diabetes. Okay, so like I said, if you look at the research, the only type of diabetes that's really supported to have a genetic correlation to it is type 1 diabetes, followed by some form of genetic susceptibility with type 1.5. Type 2, there's really not a lot of research showing genetic correlation. And this is where I think you look more at, you'll see individuals who talk about have diabetes running in their family. And a lot of times it tends to be lifestyle habits, right? So, say mom and dad have diabetes and a daughter has diabetes. Well, a lot of times they're all eating similar foods, they have similar eating habits, life habits, things like that. So, a lot of individuals like to say it's purely genetics, but you really have to look at lifestyle. And once again, families have similar lifestyles. They're eating the same foods, they're partaking in the same type of things. So, it's not uncommon to see that. And just because it runs in the family does not mean that there's not things you can do about it. Because once again, we see families full of diabetes, and a lot of times it's just they're all kind of partaking in these same things. And they might have some genetic susceptibility that just allows them to not be as durable as other individuals. But a lot of times, in regards to type 2, it's still more so lifestyle induced for sure, right? And more so habits in regards to eating that are passed down through generations. So does that kind of answer your question? Perfect. Awesome. Any other questions? Feel free to fire away. We got time. And like I said, no question is a dumb question. Um, you know, ask away. Now is the time. Okay, we got another question. Okay. So if you're diagnosed with prediabetes, does that always end up into diabetes? I think I'm reading that question correctly, and correct me if I'm wrong. So the question being is, if you're diagnosed with prediabetes, will that always lead to diabetes? Doesn't have to. If changes are made in that period, then it definitely doesn't have to be. Prediabetes is the optimal time to make the changes needed to keep it from leading to diabetes. Now, once again, if you are pre-diabetic and you just kind of continue the same lifestyle choices, eating the same foods, doing the same things, and really not changing anything, then a lot of times it does lead to diabetes, right? But it doesn't have to lead to diabetes at all. Just because you're pre-diabetic doesn't mean that that is a curse that you will totally end up with diabetes. It's pretty much just like a warning sign from your body saying, hey, we got to do something, because if we don't do something, we're going to end up with full blown diabetes. So, to answer your question, no, it doesn't have to, and it doesn't always lead to diabetes. And the key in letting that not happen is getting on top of these things, getting the appropriate lab work done, and making the appropriate changes diet wise, exercise wise, supplement wise, medication if necessary. But a lot of times, type 2 diabetes can be managed without medication, or you can get to a point where you can wean yourself off medication. So I hope that that answers your question. Any other questions? Got a few more minutes if anyone wants to ask anything. Okay. So if no one has any more questions, like I said, I'd like to thank you all for joining. Like I said, I hope you found this information helpful, either for yourself or for a loved one. Like I said, my goal is to just empower individuals and allow them to take their health into their own hands, be able to ask the appropriate questions to doctors to see if the care they're getting is appropriate. Right. So we'll be doing these every 3 weeks on different topics. We'd love to hear your kind of insight on how you liked it, if you think things could be better, if you'd like to hear certain topics. I'd love to get your kind of see what you think. So you can always give our office a call and let them know, hey, I really liked it. I didn't like it. I wish they did this instead. Or here's a topic I'd like to hear. Right. Love for you guys to follow me. So I'm on Instagram and Facebook. Always posting different things about different supplements, different disorders, kind of always posting educational things on both those things. And, a lot of times testimonials from our patients, things like that, which is cool to see. Our clinic is Integrated Health Systems. We are located in Inglewood, Colorado, right? So that's our clinic. Those are my Instagram and Facebook names. And like I said, would love to hear from you guys. Actually, let me plug in the phone number so you guys have the phone number to our clinic real quick. So the number is going to be, I'll type it in, I'll say it's going to be 303 781 5617. So feel free to reach out to us on that phone number, and you can talk with Lindsay at the front. But like I said, if you or a loved one is interested in meeting and learning a little bit more about how we may be able to help you or guide you in the right direction, please click on that Calendly link. Like I said, spots are limited and will fill up pretty fast. Otherwise you can also, if they run out, give us a call on that number. Or like I said, if you have suggestions of how we can improve these webinars or different topics you'd like to hear, just give us a call. And once again, thank you so very much for coming out, guys. And I look forward to hopefully seeing you in the next talk in 3 weeks. So have a great night.